Hello, I'm Ibrahim Imam, and welcome to this episode of the Neurology Lounge podcast. In this episode, we will continue our exploration of epilepsy. In this episode, I will be speaking to Ian Boone, author of Sacred Lives, a book that explores the cultural associations, history, and social consequences of epilepsy. Sacred Lives was listed as one of the Sunday Times books of the year 2023. I will be speaking to Ian today about the book, as well as his dual perspective of epilepsy as a neurologist and as a parent of someone who has suffered with epilepsy. Ian was born and educated in Berkshire, and he studied medicine at St. Andrews and Dundee. He was consultant neurologist at the Institute of Neurological Sciences, Glasgow, between 1978 and 2006, and honorary professor of clinical neurology at the University of Glasgow. Since retiring, he has worked on behalf of the Medical Research Council and has held lecturing positions overseas in India, Nepal, and the West Bank. Ian is trustee of several charities and a board member of the Hidden Truths Project. This is a California-based charity that champions artists with epilepsy. Ian was also chair of clinical governance at the William Corrier Scottish Epilepsy Centre and a member of the Royal College of Physicians and Surgeons of Glasgow Library and Heritage Committee. Ian's recent publications have been on William McEwan and the advent of epilepsy surgery, on animal experimentation and the anti-vivisection movement in Victorian Britain, and on the importance of history taking and examination before requesting neurological investigations. That sounds like a simple thing, but I think some principles we tend to forget with time. Ian, welcome to the Neurology Land podcast, and thanks for giving me some of your invaluable time.
Thank you very much, Ibrahim.
Okay. The usual first question I ask is why you wrote the book? What was the inspiration for the book Sacred?
I've been retired for some years. Throughout most of my professional life as a neurologist, I had a son and still have a son with epilepsy. And about 5 or 6 years ago, Tim ran into lots of issues in relation to employment and what I perceived as being stigmatization. And it made me take a step back and realize how little the ordinary person out in the street understood about the condition and how fearful they were of it and how mistrusting they were of people with it. So I thought there was the need for a book that was written at a level that could be read by both doctors, by nurses, but also by the lay public. So that was really the motive behind the book.
And how did you go about writing it? Did you take time off? Did you kind of squeeze time in? Did you take notes and compile? What was
I disciplined myself. I would do probably between 500 to 1,000 words a week. And I would do that by setting aside usually 2 hours in the evening, most evenings, between about 5 and 7. I'm very regular in the way that I do things. So I had this sort of system. And I was helped enormously by getting a copy editor from the very beginning who could look at what I was writing, look at duplication, anything that she felt was a little controversial or not supported by evidence. And this helped steer me through the book and get the shape and form of the book.
I believe it's Roald Dahl that sets time off like that to write, and he goes into a cottage. Did you have a little box or shed that you went?
I didn't have that, I'm afraid. No, I didn't. I think it was Dickens who wrote 500 words, I think, a day, but then he was writing several books simultaneously. So he had to write a lot to keep up with it. Yeah.
Well, a lot of your book was about the history and especially the history of the treatment of epilepsy, and going back to the early Roman and Greek periods where there were some interesting treatments like sea tortoise blood, crocodile feces, and ram testes. Was there any rhyme or reason to the choices of these curious ingredients?
There really wasn't. I think the basis of it was that the condition was felt by the person witnessing it to be so repellent that the only way that it could be treated was to offer some form of repellent treatment. I think that might have been the rationale.
Okay, like for like, I suppose.
Yes, like for like, yes.
I'm sure I we have to believe they didn't work. But, and then Hippocrates, the father of medicine, came into the picture. Clearly, important for dispelling the notion that epilepsy had anything to do with evil spirits. Did he advance any treatments apart from?
He didn't advance treatment, but his knowledge and the knowledge that he gave people about epilepsy was considerable. He was the first to recognize it as being a disorder of the brain. He believed that it was the accumulation of phlegm, one of the four humors, in the veins around the brain. He was the first person to describe an aura or breeze, an awareness that a seizure was going to happen. He also noticed the natural history of epilepsy, that he noted children were more likely to die from the condition than adults. So I think Hippocrates' contribution was an observational one rather than a therapeutic one.
Which is the foundation of everything else, really.
Yes.
And after him, Galen, who carried on his tradition, made a link.
Galen did, and I think Galen is the beginning of suggesting treatments for epilepsy. Galen wrote a letter, an advice to an epileptic boy, to a person that he knew. And in that paper, he recommended regular hours going to bed at night, avoiding any emotional upset or upset that could trigger seizures, avoiding the wind and the rain. He also suggested treatments, herbal treatments. So Galen, I think, was the first person to recognize that lifestyle was an issue in trying to treat epilepsy, and also that medication might improve it, might help it.
So he followed in Hippocrates' tradition that there was no link with evil spirits or spiritual.
He did, absolutely. Yes, he did. He did.
And then he made the link between seizures and the menstrual cycle.
That's correct. He did. He noted in young girls there was an increased risk of, or an increased occurrence of seizures in relation to the menstrual cycle. That's correct. Yes.
And it's sad that even though Hippocrates and Galen kind of delinked epilepsy from evil spirits, that concept came back again in the medieval period with demonic possession and witchcraft being thought to be the cause of epilepsy.
It did. Pope Innocent VIII asked two German scholars to produce a treatise on witchcraft, and this was called the Malleus Maleficiarum. And in this, the link was made quite definitely between being a witch, being a devil, and having epilepsy. Mm-hmm. And it was believed that witches could pass on epilepsy to other people as a form of punishment. This book that was produced in the 15th century was outselling the Bible. It ran to over 70 editions. It was translated into 14 languages, and it had a major impact upon perceptions of epilepsy in the Middle Ages and at the beginning of the Renaissance. And this was also perpetuated in biblical writings, but also in paintings, Renaissance paintings of the casting out of spirits, the casting out of devils. I think a thing I should say at this moment is that my book was very much culturally written from a Western perspective. And that, I think, is a very important thing to say, because the only perspective that I have is a Western perspective. And therefore, I can't really be blamed, if you like, if my view of epilepsy is really quite a narrow one, when one looks at a condition that is worldwide throughout so many different cultures and so many different religions. So I've scratched at the surface of what I know.
I don't think there's any reason to think other cultures treated people with epilepsy any different early on. I think the concept of it being infectious, people avoiding the saliva of people with epilepsy is something that we have in many African traditions. And even recently, people with epilepsy in some places have their feet burnt in an effort to get rid of people. Yeah, so for some reason, epilepsy conjures this link, I think, with evil and spirits. I suppose, is it because it's just one of the most misunderstood and the most evident disease? It's kind of just in your face, isn't it, when somebody's having an epileptic seizure?
Through the contacts I made with the book, I got in contact with a neurologist in the Democratic Republic of the Congo. And I certainly know in the culture that he works in, the majority of people will not go to the doctor for treatment of their epilepsy. They will go to the local healer, and their treatments won't be treatments. They will be, again, adding to the stigmatization, enforcing isolation, enforcing the fact that marriage is wrong, having children is wrong because of the possibility of hereditary epilepsy. So there's an enormous worldwide mountain to climb in terms of educating people throughout the world about this condition.
Yeah, we have a long way to go with that.
We do, I'm afraid.
And coming to the end of the 16th century, that's when you said the physicians became no longer bound by the dogmas of the church, and this gave them the freedom to view epilepsy as a disease rather than a supernatural curse. But even then, this idea of demonic possession thrived. Is this kind of the thing with medicine where we struggle to get rid of dogmas and change the paradigm? That's, I suppose, what's going on here, isn't it? Or was it just a lack of evidence?
I think the lack of evidence, I mean, when you talk about the concept of demonic possession, this persists in Europe right into the 20th century, where there were still exorcisms being carried out by priests on people with epilepsy, the most famous of which was a young German girl, Anneliese Michael, who in 1976, two priests carried out multiple exorcisms to try and rid her of what was believed to be demonic possession. And in fact, a feature film was made about this called Requiem, that tells the whole story of her life. And tragically, she died in the end as a consequence of the exorcisms and multiple fractures and weight loss and all sorts of things that happened to her. So this concept that it is the devil that is causing this condition, even in cultures like Germany, persisted into the 20th century.
Was she the inspiration for the film The Exorcist or somebody else?
She was. There's an American film called The Exorcism of Emily Rose, which is an Americanization of the same story, but it really doesn't tell the same story. And actually, it stigmatizes epilepsy by taking the view that she actually was demonically possessed. Whereas the German version of the film, of the story Requiem, tells the true story.
Interesting. Something for me to look into. And then coming into the 17th century, and the great Thomas Willis, kind of founder of neurology, was still advocating kind of things you would have thought will have been out of the armory by then: bloodletting, smelling salts.
Bloodletting, smelling salts. Certainly at this stage, there was, again, the realization that it was a physical condition, the realization that it required to be treated by a physician rather than by a priest. Okay. And Willis perpetuated that in terms of his efforts to understand epilepsy, or be these fairly primitive concepts, and also to provide treatments which were not really based on science.
Okay. I did think for a rational man, there should have been a rational decision behind it, but clearly the whole idea is that this is a treatable condition.
Yes.
By physical measures. Okay. Then the 18th century, there's so many people you talked about, but I picked up a Swiss physician, Samuel Auguste Tissot, Tissot, I presume, who attributed epilepsy to sexual excess.
He did. He wrote a book. Well, he wrote two books, if I can. He wrote two books, one of which was called A Treatise on Epilepsy. And here he put forward the concept that epilepsy might have a hereditary basis. Okay. He also poured cold water or scorn on the concept that if you witnessed a seizure, you would yourself develop epilepsy. Mm-hmm. But the final thing is that he wrote a textbook in 1770 entitled On Masturbation. And in this book, he put forward the theory that masturbating was a trigger for seizures. And this led to it led to castration. It led to surgery on young girls. It led to treatments that obviously were completely and totally based on a misconception and were cruel in themselves.
So much to unpick there. But granted, there's no evidence for any of this.
There's no evidence for it at all. No, no, not at all. Not at all.
A lot
No.
of young people would be relieved to hear that.
He made one other interesting contribution, Tiso, and that was that he reinforced the concept of trephining, drilling a hole in the head for people with epilepsy. And he made the recommendation that if someone had epilepsy, the best place to trephine was over an old skull fracture, if there was one.
Okay.
He also, interestingly, reported the first ever case of epilepsy. He carried out a post-mortem examination in a patient, a young man who'd had epilepsy, and found an underlying brain tumor.
Okay.
So again, he made this connection between structural brain disease and epilepsy, which had not up until that time been made.
Interesting. And then he introduced the concept of idiopathic epilepsy.
That's correct. Yes, he did. He did. Where there was no apparent cause and no apparent trigger, it just arose for some reason in certain individuals. Yes.
And then the next person that came to mind for me was Albrecht von Haller in the 18th century, and this concept of irritability, which Tissot first obviously indicated. Von Haller is one that kind of put it more to the foreground, is he?
That's right. I mean, Haller is regarded as being the father of physiology, and Haller recognized that if you stimulated a nerve, it would cause a twitching movement. Mm-hmm. And so he thought, well, if seizures consist of twitching, then these twitchings must be generated by nerves and must be generated by irritable nerves. And he introduced this concept of excitation of nerves and inhibition of nerves. And the imbalance of the two resulted in twitching, resulted in a seizure. So Haller was really beginning to understand the modern concept of epilepsy and producing the groundwork to lead on to people like Hughlings, Jackson, and Gowers.
Very revolutionary. And then the 19th century brought a lot of positives to the understanding of epilepsy. But you did mention that the Victorians still had this beliefs of linking epilepsy, this time with poor morality. How did this further stigmatize people with epilepsy, and did it have consequences, kind of going to jail?
I think up until the beginning of the colony movement, people with epilepsy were generally looked after in asylums. And before the concept of the neurologist, they were looked after by this hybrid neurologist, psychiatrist called an alienist. The alienist would look after the patients in asylums with no drug treatments. And so the treatment of epilepsy was social isolation if you were poor. If you were rich, it was concealment of epilepsy. And William Morris, the designer, his daughter Jenny had epilepsy. And William Morris took Jenny to see William Gowers in London. And Gowers, sorry if there's a dog barking in the background. so these things happen. Took Jenny to see Gowers in London, and William Morris would never accept that his daughter had epilepsy because of the social stigma associated with it. And again, the concept that there was in some way that it was immoral, that it was the result of bad living.
Did it have consequences where people kind of have an epileptic episode and you're kind of taken straight to jail because you're an immoral person? Right?
Yes, that's exactly true. That would happen, that people would be incarcerated. And you know, we think of that as something that ended, you know, in Victorian times, but there was an act, what's called the 1913 UK Mental Deficiency Act, that again resulted in the incarceration of people with epilepsy. So even into the 20th century, even though now Gowers, Hughlings, Jackson Haller, they had all worked out that this was an illness, and an illness requiring treatment. Society still regarded this as a condition that required incarceration or removal.
Did they go to the extent of the eugenics movement at the time, I suppose, was thriving? Were people with epilepsy victims of this movement as well?
They certainly were. And I mean, Galton, who was published the book, I think it was called The Hereditary Genius. Galton started off being interested not in people who couldn't perform, but why were certain people geniuses? And why do they often come from families of geniuses? And so Galton looked at this and thought, well, why can't we create a world of geniuses? Why can't we get rid of those who are not geniuses? Why should we let the poor, the illiterate, the unemployed, why should we let them breed? Surely we should be letting breed the people of wealth and intelligence and sophistication. And so Galton drove the beginning of the eugenics movement that persisted right up until the Second World War. And led to, in National Socialist Germany, led to the eradication, basically the killing of people with psychiatric illness and with epilepsy.
Yeah. But then a more compassionate approach to epilepsy emerged also in the 19th century. Who are the heroes of that movement?
In the United Kingdom, they were, I suppose you would regard them as benefactors. William Passmore in London, who was a businessman, established the epilepsy colony at Chalfont, in the belief that if rather than sending people to an asylum, you should move them out into the country, you should move them into a sheltered, quiet environment, give them something to do, a job, to work there on the farm or whatever, and that would improve the quality of their life. And a similar view was taken by William Quarrier in Glasgow, who was a local shoe manufacturer, who opened a home, Quarrier's Homes, for orphaned children, but also opened what was called the Colony of Mercy for Epileptics, which was a small unit that would take people out of the city where they lived and the poverty that they lived in, removed them to the country and try and improve the quality of life. This wasn't just in the United Kingdom. In Germany, the Bethel community was started. In America, an extraordinary entrepreneur, William Letchfield, traveled the breadth and length of Europe, learning about all of these epilepsy centers, and went back to New York and established Craig Colony. And he employed one of the first epileptologists, William Spraitling, who worked there as a physician. So we were beginning to see improvement being driven by the Victorian benefactors, men who'd made money and wanted to contribute to society and improve social justice.
And were they inspired by the psychiatry movement, Philip Pinel and the rest, who were doing a similar thing to people with psychiatric illnesses? Or was
That's right. Yes, I think they were. I think that's right. Yes.
And then we come to the scientific part of the 19th century, and clearly the English neurologist John Hughlings Jackson stood out. He brought a scientific rationale to the understanding of epilepsy. Apart from describing this Jacksonian epilepsy, which starts in one part and then creeps and takes over and becomes generalized, what is his epilepsy legacy? What did he advance?
I think his other great legacy was the concept of hierarchy within the nervous system. The realization that you built, as your brain developed, if you like, layer upon layer of skills. Okay. And then if you had something like a stroke, there would be a dissolution of those skills, that they would revert back down several levels. So he created the concept of hierarchy within the nervous system, the way the brain developed, the way that skills were learnt, acquired, and laid down layer by layer. He was an extraordinary person, Hughlings Jackson. Again, what it came down to with him was observation.
Mm.
His observational skills were just extraordinary. There was nothing that he would miss. There was nothing that he wouldn't write up and describe. There's a wonderful book about him by Samuel Goldblatt about Hughlings Jackson. It's probably the best biography. It was published in 2021. I think it's Cambridge University Press. And it really is a magnificent account of Hughlings Jackson's contributions as the father of neurology in the United Kingdom.
And I think even the great Charcot appreciated Hughlings Jackson. I think he was one of the few people he respected.
I think that's right. Yes, yes, yeah.
And then equally, well, maybe not equally legendary, William Gowers, whose career overlapped with that of Jackson at Queen Square. What did he contribute?
Gowers, again, it was observational with Gowers. Gowers, he published, first of all, in 1881, I think it was, Epilepsy and Other Chronic Convulsive Disorders. He observed cases. He believed epilepsy to be a disorder of the grey matter. He again advanced the theory of excitability and inhibition, but also he recognized non-epileptic attack disorder. And he wrote another book in 1907 called The Borderlands of Epilepsy, which gives an extraordinary account of the differential diagnosis, including non-epileptic attack disorder, syncope, cardiac disorders, migraine. All of these things he listed as being in the borderlands of epilepsy and conditions that you would need to recognize and exclude before you diagnosed epilepsy.
Interesting. Yeah, I think there's a recent biography of Gowers as well. I can't remember who wrote it. It's interesting. Okay. I think there are too many personalities for us to go through. We'll move on to the anti-seizure medications. And at the time of writing, there were 25
Yes.
And what struck me was that most of these were not discovered by any rational approach. It was kind of more serendipity and good luck. Are we suffering by abandoning serendipity in the search for medications?
I don't think so. I think there are probably three phases here. And when you mention serendipity, bromide is the first thing, that it was just noted in women with eclampsia to be a treatment given, and it was noted that it actually could inhibit their seizures in eclampsia. So bromide was introduced as an eclampsia treatment. A young German doctor, Hauptmann, was studying for his exams in a psychiatric hospital that had a lot of people with epilepsy. Okay. And there were noises from people having convulsions during the night. So he thought that he would treat them with phenobarbital so that he could get on with his studies. And the patients treated with phenobarbital enjoyed miraculous periods of seizure freedom. So that was a serendipity. You then move on to the first ever clinical trial, which was Merritt and Putnam in 1930, I can't remember the exact date, but it was the first clinical trial of phenytoin in epilepsy. Then you move on from that to the multiple clinical trials that we've all been involved with, and some of them negative, some of them positive, vast numbers of patients included, with all sorts of different types of epilepsy. And I think we're moving away from that now with the understanding, the sort of genomic explanations of epilepsy, to perhaps targeted drug treatments, where we can define what the problem is and therefore target our treatment more effectively in the proper, more likely to respond treatment group. So I think there's a full circle here from serendipity now to targeted treatment, and targeted treatment is the way forward.
Okay, thanks for that. No N is equal to 1 trials for these medications. Okay, and your exploration of epilepsy in the arts was also quite detailed. Did the arts reflect society's view of epilepsy, or did it influence, or did it do both?
I think across a whole range of arts. I mean, I suppose to take the most modern art of all, and that is television and film, then the message that they put across is essentially a negative one of epilepsy. People with epilepsy tend to be bad. they tend to be men. The only people that seem to be good are in films where women have epilepsy and they're shown as being beautiful and vulnerable. But the film world really hasn't done epilepsy any favors. There's one or two outstanding films that have, like Electricity, which is an excellent account of a young girl suffering from epilepsy and how she manages it. The press don't do epilepsy any favors. Most of the stories in our UK press about people with epilepsy tend to be negative. When you look at writing, there are very few writers who've written about their epilepsy. Dostoevsky, obviously, Margaret Evans, a Welsh writer. They're probably the only two that spring to mind. You've got other writers like Laurie Lee or Edward Lear who hid their epilepsy, who concealed it. So when you look at the arts, it's a mixture of things. But I suppose the bottom line is that most of what is in pictorial, written art, performance art tends to be on the negative side and doesn't really promote a positive perception of epilepsy.
And I think the lesson I took from the various accounts you gave is we are more likely to get a good picture, a positive picture of epilepsy in the arts written or whatever done by people who suffer epilepsy. And Dostoevsky was one. Gustav Flaubert was another one.
Yes.
Are we getting more of that now, or are we still seeing epilepsy portrayed by other people?
My involvement with the American, the Californian group Hidden Truths is very much about trying to promote the artwork of people with epilepsy. And their artwork may be the consequence of their epilepsy or have nothing to do with their epilepsy, but they have epilepsy and produce art. And so I think Hidden Truths is, if you like, a vehicle to try and put across to the general public that people with epilepsy are just like anybody else. They can paint, they can draw, they can write music. They're not, as the public perception is of people with epilepsy, people who are damaged and therefore do not have skills and tend to be less bright and tend to be less able. That's a public perception. And an organization like Hidden Arts and authors and writers talking openly about their epilepsy will perhaps do a great deal to lay low, to end that false impression.
And still on the arts, a colorful figure was Vincent van Gogh, who...
Yes.
How much did his epilepsy influence his work?
It's a big argument about Van Gogh. The thing that supports the fact that he possibly had epilepsy is the fact that he was on digitalis. And digitalis in those days, again, not really with a rational basis, was a treatment for epilepsy. And there are hints throughout his behaviors, if you believe in the so-called epileptic personality, there are certainly parts of Van Gogh's behaviors, his hypergraphia, for one thing, he just couldn't stop writing letters to people. There are certain things there that point to the likelihood of epilepsy, but not the certainty. Now, to go back to digitalis, the side effect of digitalis is that it impairs color vision, and in particular impairs yellow color vision. And some people, maybe reading too much into it, liken Van Gogh's yellow period of painting to the fact that he was on digitalis for his epilepsy. It's very speculative, though, like so many of these things.
Retrospective diagnosis
Yes.
comes with its own perils. And epilepsy with music. And one of the people who stood out was Frederick Chopin.
Yes.
Is epilepsy more likely to show in musicians, given the just kind of...
I don't think so. I mean, there was a paper written some while ago that said that people with epilepsy did not have musical ability, and that's not supported. I mean, if you look across the board of kind of modern contemporary musicians, from Susan Boyle, Elton John, Prince, all of these people had epilepsy and performed, and there are performing to this day people with epilepsy performing music and writing music very effectively. The interesting thing about epilepsy is the link between music and seizure inhibition or seizure triggering. Musicogenic epilepsy on the one hand, and
Yes.
on the other hand, the strange finding that one of Mozart's piano, I think it's a piano piece for two pianos. I can't remember the number of it, but it seems to inhibit seizure activity on EEGs.
Hmm.
So music may have a triggering effect. It may have a therapeutic effect. It's interesting.
Interesting. I think Yanni's music also had this calming effect. I think it's similar to Mozart's piece, I understand.
Yes.
Okay. We now come to something more personal. Again, your son suffers with epilepsy. How has this sensitized you to how society conceives of people with epilepsy?
I think on the first hand, I've seen right from early childhood, Tim's epilepsy started around the age of 3, and I was conscious of, as a parent, and we're talking here in the 1970s, of stigmatization. I was aware of that.
Mm.
And the dilemma that every parent had, did you tell the teacher? In which case the teacher would, in those days, put down any academic failings to epilepsy, and therefore a situation that could not be improved upon. Or if you did tell the teacher, how safe were you with the knowledge that that would be kept confidentially between you and the teacher, if the teacher then had to inform other parents and other children of any degree of risk? So there were ups and downsides of it all. I suppose what I learned over the years was that there was so much stigma out there. And that's one thing that I learned. The other thing that I learned practicing a neurologist, epilepsy was never my specialty as a neurologist. I was a general neurologist with a particular interest in stroke neurology. But I did see people with epilepsy. And what I learned, I suppose, from Tim is that one seizure is one too many. If somebody came to the clinic and said, I've had one seizure in the last year, somebody who didn't have a great deal of empathy might say, well, that's good, well done, that's great. But one seizure is one too many. And one seizure removes confidence, self-esteem, fear of going out in the public after a seizure. When Tim was at university, he took a seizure in a class of over 200 pupils, other university students. And his courage, which deserves a medal, was he went back to the lecture theatre the next day for the next lecture. And that again is something, unless you're facing it personally and living with it, you don't realize the enormous courage that people with epilepsy must have to pick up and go on and continue. So I learned a lot, and I hope it made me more understanding of people, more aware of side effects rather than dismissing them. I think I learned a lot from it, but it was a hard lesson to learn.
And he's doing well now. Seizure free.
Yes, he is. He is. He manages it, would be the best way to say, Ibrahim. Yes, yes.
And you did say one seizure is too many. In practice, that there are people who find it difficult to have their seizures controlled. And you start with monotherapy, you go to, polytherapy. And then we have options now, epilepsy, surgery, and all the other things. But there's always that risk that you go too far with piling up more and more new medications, and we have one or two coming out every year.
Yes.
Where do you draw the line with regards, or do you ever draw a line with regards to medical treatment?
I think it's very, very difficult to answer that. I think the first thing to say is the choice of changing drugs must always be the patient's choice. And we must never underestimate that somebody who's on a drug treatment that you and I might regard as being rather old-fashioned, they may have an enormous amount of faith in that treatment. And you should never be saying to somebody, this is a nonsense treatment, let's try this new drug. I think you've always got to respect the patient's perception, even though in your heart you might think, well, actually, they might do better on this other drug, but you should never push it. When to stop? I don't know the answer to that. I think it's accumulation of side effects that is the biggest problem. I remember having a patient with epilepsy who I can't remember the anti-epileptic drug they had been on for some years. And they actually decided of their own accord to stop. And they came to the clinic and they said, for the first time in 5 or 6 years, I can see the world clearly now. It was as though I was looking out of a frosted glass window, and now I'm looking out of a clear window pane.
Interesting.
And I've always remembered that and thought, well, for that person, having the seizure was less damaging than having the treatment.
Yeah, it's a difficult one, I suppose. Many of these combinations end up knocking the patient virtually out of quality.
Yes.
I suppose trying to get the right balance.
Yes.
Okay, and epilepsy surgery again has its own downsides. Do you have any experience of that with your patient?
I did. When I came to Glasgow, there had been no epilepsy surgery program, and in the 1980s, myself and one of the neurosurgeons, we restarted the program. So I did have some hands-on experience before then handing on to somebody else who was more of an epileptologist than I was. I think the problem are the numbers. I mean, if you look worldwide at access to epilepsy surgery, it's virtually non-existent. It's so small. Even in North America, where you'd think that access would be far greater than anywhere else, it's not that good. I think that is the problem with epilepsy surgery, that only a small fraction of people can get there. And I suppose we worry nowadays with what we see happening to healthcare, where at the end of the day, the people that get to surgery, it may be the people who can afford to get to surgery. Maybe that's the future of the way things are going here. I don't know. That's another story.
That's another story. Another podcast. We've kind of covered a lot of ground, but I have to say, it doesn't do justice to the number of things you've covered in your book. Are there any lessons we haven't talked about that you kind of want a reader to take away from the book?
I think the reader, I suppose there are two types of reader. There's a reader who has no epilepsy in their family and is just reading this to find out about it. And there's a reader who does have epilepsy in the family. I think for the reader with no epilepsy, it's to understand not to be fearful of the condition. There was a study looking at people who were witnessing tonic-clonic seizures and what were their feelings about it. And the feelings were one of, trauma. They were traumatized by witnessing it for the first time, and one can understand that. So I think it's teaching those without that there is nothing to be scared of here at all, that people with epilepsy are just like anybody else. They're like somebody with migraine. Only it's visible, and the migraine isn't visible. To people with epilepsy, I suppose it's this fight against stigma, trying to tell them that they're not on their own, to tell them there's an enormous amount of history to epilepsy going back thousands of years. But things are gradually improving. Things are better than they were. The introduction of epilepsy specialist nurses in the UK, the wider range of drug treatments, people are speaking more openly about it. I think that things have improved, but there's an awful long way still to go.
Awful long way to go. What are the uncertainties in the field? What, especially of treatment? What are there questions, uncertainties?
I think, again, it comes back to the kind of genomic studies, and can you identify different types of epilepsy and understand what their, if you like, their molecular basis is, and will that lead on to better treatments and targeted treatments? And hopefully so, but I think we still have to wait and see.
Precision treatment. I think that we already have that with things like carbamazepine. We kind of check who is likely to react to it. Hopefully the future holds a lot of good things. What you did mention some of the projects you are on at the moment. What does it entail?
There's only one thing I'm really doing at the moment, and that is with my colleagues in America, with Julie Dobson Tompkins and Stephen Shatner and a lady there. We're looking at trying to put together a book proposal on just looking at the art that people with epilepsy produce, what their stories are behind the art that epilepsy produces, and what the benefit is for them and society generally in trying to understand more about epilepsy through this.
Excellent. And you've already made quite a few book recommendations. Are there any you want to add to it?
I wrote a little list here somewhere. I think if I can find it. Where is it? Yeah, there were maybe 3 books.
Yes.
Colin Grant's The Smell of Burning.
Okay.
Colin Grant is a West Indian author living in the United Kingdom. He's a playwright, and he writes about his brother's epilepsy. And it's a very, very moving book, and I would recommend that. There's a book by a Welsh writer, Margaret Evans, and that's called A Ray of Darkness, in which she describes her own epilepsy. And there's one scene in it when she describes herself waking up beside the stone hearth of her fire and the fire still on, and realizing how she could have fallen into the fire. And she looks and sees that the sleeve of her dressing gown is singed. It's an incredibly moving book about living with epilepsy. There's always Temkin's book on the falling illness, which is a wonderful book. But one other thing I'd recommend, I just hold it up if you can see that.
Yes.
It's a book by Imogen Tyler on stigma. And even though it's not a book about neurology, it's not a book about the brain, it's a book about stigma. And one of the things she covers in the book so well is the politicization of stigma. How stigmatizing people with long-term conditions, with chronic illness, can be used by politicians. I think maybe, without being too controversial, we may be seeing a bit of that today in terms of looking at the benefit system. Somebody on benefits who has epilepsy would rather not have epilepsy than have the benefits. And I wish some of the people who speak so badly about people on benefits would begin to understand that. And Imogen Tyler's book on stigma is a wonderful read, and it tells you the whole history of stigma from the beginning to the present day.
And there's obviously quite a lot of it still around. Hopefully your book and this podcast will do something to dispel the...
Hopefully.
Ian Bone, thank you very much for participating in this episode of the Neurology Lounge podcast. I'm most grateful. And to my audience, thank you for listening or watching the podcast. If you found it enlightening, you might want to read my book as well, Surfing the Brain, which covers other issues about neurology. And for more academic reading or checking up, you can check my Neuro Checklist website. And to make sure you don't miss the next episode of the Neurology Lounge podcast, why not subscribe either to the iTunes, Spotify, or YouTube channels? And I'm hoping the next one will be as interesting as this. Ian Bone, thank you very much for your time. I'm most grateful.
Thank you.